Well, for more, I'm joined by Dr. Veer Pushpak Gupta, who's been on the front line treating coronavirus patients in the UK for the past 8 months. Doctor, thank you so much for your time tonight. Well, it's morning there for you. How will you be involved in this rollout?
Yes, thank you for having me, Karina. Yes, indeed, it is morning here. Really excited about this rollout. This has been a long time coming, but also I think for frontline workers that have been involved in this fight against coronavirus for the last 8 months, I think this is our time that we fight back against the virus. I'm so excited about today because today is a great achievement for science. We have a vaccine for a disease that was never before seen on Earth. And within 1 year now, we have something that can actually prevent it from spreading. And I think that's going to be a huge achievement for all of us. So really looking forward to it. I will be involved in the process of administering the vaccine, but also looking for any immediate side effects and medical concerns with patients after we administer them.
You said you're excited and looking forward to this rollout. Was the approval rushed in your view at all?
I don't think so. I don't think so. If you think about the way that this vaccine works, it's an mRNA vaccine. It is the first time that it has been used on humans, but the research that has gone behind it has been happening for years and years before the point that we've come to right now. So I don't think that it's only within the last 12 months that the production of this vaccine has taken place. The science behind it has been there for the last 10 years, and scientists have been working on it for a while. I do think that there is a bit of a PR problem with the vaccinations for COVID, and I think that we need to sort of give people a lot more confidence in the science behind it and have them trust the vaccine to do its job.
So what are patients telling you then about their apprehension or excitement about the vaccine?
It's a bit of a mixed bag. I think the last data that I read online said that about 70% of British people are going to take it, and they don't have an apprehension against it. But I think also some of the younger people are sort of more skeptical. So it's a bit of a mixed bag. I think that if once we start this vaccination program, which has started today, and people do start to take it, and then eventually other people see how it's working, especially in relations to side effects, I think more and more people will be more interested with the vaccine.
Will you be getting it yourself?
Yes, as far as I know, at the moment, we're giving it to 80 and above, and especially care home residents and care home workers. But after we do that, the government has said that they will be inoculating frontline workers, and I think that's really important in a way, because that would be a way that the government would say thank you to all the people that have been working so hard in the NHS for the last 8 months.
Talk us through this process to get the vaccine from Belgium to the UK after this emergency approval was given last week.
This vaccine is a logistical challenge in every respect. It's a new technology, and hence it needs to be stored at -70 degrees Celsius. You need cold storage for that. You need dry ice. You need thermal sensors. You need an entire logistical supply chain that can only be run effectively if the government's involved. And it was brought into the UK, I think, last week from Europe, and now it's being distributed amongst 50 to 70 hospitals around the country, which will be the place where it'll be stored. And then it'll be distributed to the administration centers. So, for instance, in our area, we have a community hospital and a conference center that has been selected as the place that we will be administering the vaccine. But it's going to be a logistical challenge. And that's probably why I believe that it will not be the vaccine that will be used for mass inoculation. I still think that AstraZeneca and the Oxford vaccine, which can be stored at much higher temperatures, will be the one that will be used for mass inoculations in nations, especially developing nations.
Yeah, you talk about the challenges with the very cold temperatures that the Pfizer vaccine requires. Is that also why there is a delay in the rollout of the vaccine to aged care home residents who were meant to be at the front of the line for this vaccine?
That's right. They're still at the front of the line. The first people that are going to be getting it are the aged care home residents within the United Kingdom. And then it will go to the care home workers that are taking care of them. And then it will be phased rollouts to different age groups. So 75 and above, 70 and above, and so on. with an emphasis on frontline workers and hopefully also ethnic minorities that have suffered disproportionately higher in terms of COVID casualties in the United Kingdom.
I'm really glad you bring up the ethnic minorities point, because I wanted to ask you about that. Do we know yet the Pfizer vaccine's efficacy for, say, people of South Asian descent? Because in the first wave in the UK, they were disproportionately represented in the fatalities from COVID-19.
Yeah, absolutely. You know, the BAME population, as it is called in the United Kingdom, was disproportionately affected. The science behind that is that a lot of the ethnic minorities live in either impoverished conditions, or they also have blood vessel disease, so diabetes, heart disease, and that can be a significant factor when patients are admitted with COVID. I'm not aware of Pfizer being particularly helpful with the South Asian population. I'm not sure if they've actually done a trial that focuses on that, but they did do a trial over 45 to 50,000 people over 6 countries, which showed positive results. So I'm hoping that some of those patients were actually of ethnic minority populations.
Dr. Veer Pushpak Gupta, a remarkable day taking place there in the UK, and thank you for all the work that you've been doing.
Thank you very much.